the lotus feet of Bhagwan, respected Director Sir, elders, my dear colleagues. In June 2013, by Swami's grace, the M.Tech in Nuclear Medicine course was started. It is a course that is run jointly by the Physics Department of the Sri Sathya Sai Institute of Higher Learning and the Nuclear Medicine Department of the Sri Sathya Sai Institute of Biomedical Sciences, Prashanti Gram. The 5 seats that were up to be filled were filled immediately by these 5 bright postgraduate students of our university. In the first semester that they have already studied, they had 2 days where they would spend in the department here and 4 days they would spend in the college. And in the second semester that they are currently studying, they are now spending 4 days in a week here in the Nuclear Medicine department and 2 days for their theory lessons in the college, in the university. Under the able guidance of Dr. Shiva Subramaniam, the HOD of Nuclear Medicine department, these bright students have already made a presentation in a national level conference in October 2013 at Chennai, when they were merely 3 or 4 months old into the course. That is, of course, with the blessings of Swami. Today, these students will hold the seminar proceedings on molecular imaging, and the proceedings will be as follows. After an introductory video, Mr. Jagdish will speak on the modalities in molecular imaging. This will be followed by the topic molecular imaging in cardiology by Mr. Osho Sai. Then molecular imaging in oncology by Mr. Shiv Narayan. Molecular imaging in orthopedics by Mr. Sai Saranjeevi. And then finally, molecular imaging in urology by Mr. Rahul Namdev. The seminar will conclude with videos on Swami. I now invite these Nuclear Medicine M.Tech students to take over the proceedings.
This is a small introductory video on molecular imaging.
When it comes to your health, what works for others may not work for you. You're unique and you deserve custom treatment. Molecular imaging and nuclear medicine provide highly personalized care because it's all about you. Molecular imaging technology goes further than other diagnostic methods. Molecular imaging sees your body in real time. It gives you and your doctor more than just an accurate picture. It also shows exactly how your body is functioning. Molecular imaging sees deeper. It can see a disease very early and before symptoms occur or recur. It can pinpoint exactly where treatment is most needed. It can determine if the treatment is working long before other imaging technology can. Molecular imaging sees the future. It's opening up a new understanding of cancer, heart disease, neurological disease, and other conditions. With each scan, physicians and researchers gain better insights into human physiology. Molecular imaging is pain-free. It requires no invasive surgery and no hospital stays. Safe, using precisely targeted tracers that can contain small amounts of radiation. It delivers large amounts of information about how your body works. More responsive. It lets your medical team know sooner how the disease responds to treatment and if you need a different medicine, because time matters. And some molecularly targeted treatments, such as radioimmunotherapy for certain lymphomas, have extraordinarily high cure rates. Molecular imaging is transforming medical care, one patient at a time. And we're just getting started. New imaging technologies are opening up new possibilities in diagnosis and treatment, helping you and your doctor make the most effective choices for your care, and giving you confidence that the treatment you receive is personalized to your needs. So get personal with molecular imaging. Learn more about molecular imaging and personalized medicine at discovermi.org.
And Jagdish will speak on the molecular imaging modalities.
M.Tech, and offering at the Lotus Hospital of Government Program, respected director of the hospital, and elders, and dear brothers and sisters, allowing silence to one another. Today I am going to speak on molecular imaging and its modalities. First of all, one can define molecular imaging as it's a non-invasive technique to visualize, characterization, and measure the biological process at molecular and cellular level, and it will help us to diagnose the disease at the early stages. So, in molecular imaging, imaging agents are probes which are used for visualization, characterization, and all things, which incorporates the fundamental knowledge of cell biology and molecular biology, and it can reveal the causes of the diseases and provide the clues to the prevention tool. So, this is the typical cycle of molecular imaging. It will start with the basic chemistry of the biochemistry of the disease, and we will synthesize the specific targeting agents for the targets inside the cell. These targets can be either mRNA, protein, or receptors on the surface of the cell. And after targeting, we will go for deep physical imaging, and that is animal studies. And after that, histological validation and translation into the clinical imaging. So these are the whole picture of molecular imaging. These are the targeting molecules which are using. It can be viruses, antibodies, peptides, and small molecules. These are the signaling agents. For different molecular imaging modalities, different signaling agents are used. For PET, they are using a short half-life radionuclides, that is 18F13C, and SPECT, they are using single photon emission radionuclides. And for MRI, they are using galvanium chelates and iron oxide nanoparticles. And for optical imaging, they are using quantum dots and here infrared dyes. And for ultrasound, microbubbles, missiles, etc. they are using. And these are the targets inside the cell. This can be either receptors, enzymes, DNA for the targeting. So molecular imaging can be two types. One is direct imaging and another one is indirect imaging. In direct imaging, we are targeting to the proteins or mRNA which are already present inside the cell. So we can see in this image, DNA is transcribed to the mRNA. This is the antisense DNA which is specific to this mRNA, and when these two combines, it will stop the protein synthesis and it will trap inside the cell. By using one signaling agent, we can image this inside the cell. So in indirect way, we are introducing the reporter genes, which is going inside the cell nucleus, and it will produce the mRNA, and it will produce reporter protein. So this reporter protein we are imaging by using the probes which are specific to this reporter protein, and by signaling agent we are imaging this. This is the indirect way of doing molecular imaging. And these are the currently available molecular imaging agents. These will be small molecules like glucose, FDG, this is the PET and peptides, antibodies, optomers, antibodies, and nanoparticles. So the molecular agents should have some specific characteristics. So these are the characteristics. It should have good ratio of specific to non-specific binding. It should bind only to the specific target, and high selectivity for biochemical targets, and suitable pharmacodynamics. Whenever we add drug molecule to that molecule, it should have suitable pharmacodynamics, and it should be excellent in vivo stability. It should not affected by any biochemical process occurring inside the body, and it should have good safety profile. It should be biocompatible, and time and cost effective synthesis, signal amplification, and multiplexing capabilities it should have. So these are some of the advantages of the molecular imaging over conventional imaging. So because here we are doing non non-invasive study, so no need to cut the body or anything, and it can trace the movement of the cells and thus pursue the dynamic biological process and within the microenvironment. So in molecular imaging, we are doing the dynamic imaging, whereas in vitro study, we are doing static imaging. Rapid information concerning pharmaceuticals. Suppose we are attaching the drug molecule, we can know about the drug efficacy, metabolism, of the therapeutic, potential of the therapeutic of the drug molecule. And molecular imaging makes it possible to perform repeated studies in the same animal. And we can get the better image resolution and sensitivity by using different specialized molecular imaging modalities. So these are the molecular imaging modalities currently using. These imaging modalities are used preclinical stage and CT, PET, SPECT, MRI, photoacoustic and all. The optical imaging technique is still in preclinical stage, and the remaining imaging modalities are currently available clinically. Clinical available imaging modalities are PET, and MRI, magnetic resonance spectroscopy, hyperpolarized MRI, and ultrasound. So these are the preclinical molecular imaging modalities for imaging of small animals. So optical imaging, MRI, micro-PET, micro-CT, and ultrasound micro-CT. So these are the different imaging modalities and the range of imaging detection range. For example, if you take the plain CT, it will give only anatomical information and little bit physiology, and ultrasound it will give anatomy and physiology as well. And MRI, it will not give much more molecular, and it will give only anatomy, physiology, metabolism. Nuclear imaging is lack of anatomy information, and it will give physiology, metabolism, molecular information. So molecular imaging is CT. So nowadays they are using iodinated nanoparticles for cellular imaging of the macrophages infiltration, natural storage plate in rabbit using multi-dimension computed tomography. And they are using gold nanoparticles also for imaging the cancer and the cellular molecular level. Because it's gold nanoparticles which has strong X-ray attenuation, so the contrast will be more. These two images, this is the untargeted image of the tumor. After 1 month, the tumor size you can see will increase. And after treatment, this is the tumor. The size of the tumor will be reduced. And after 1 month, the slow growth in tumor we can see by using this contrast vision, better evaluation. These are the strengths and limitations of the molecular imaging CT. The strengths are it will give the limited depth penetration, high spatial resolution, and good temporal resolution. And it has got some limitations also. It has poor sensitivity and limited soft tissue resolution, limited molecular imaging application, and ionizing radiation. So in molecular imaging with MRI, we are using superparamagnetic iron oxide nanoparticles functionalized with some specific peptides for detection of early atherosclerosis events. And glioma imaging also can be done by using superparamagnetic iron oxide nanoparticles functionalized with peptides specific for matrix metaproteins. And imaging with alpha, gamma, beta 3 ingredients using gadolinium containing liposomes. This is the image which is taken by the MRI, molecular imaging, and here we can see the tumor when no image is added. If you add the iron oxide nanoparticles, contrast will be little bit enhanced. If you use targeted iron oxide nanoparticles targeting specific molecule, you can increase the contrast and better evaluation. And some specialized MRI techniques. This is a weighted imaging. So it detects mainly due to the apparent diffusion portion of tissue water. Suppose tissue with high cellular display, it have low ADC value, and tissue with less cellularity it will give high ADC value. So in this case, ischemic stroke, diffusion weighted imaging can be used to identify regions containing soluble tissue and thus determine whether the thrombosis may be effective or not. And blood oxygen level dependent imaging. Both works mainly by using the blood oxygen levels in the oxygen level and deoxygenated in the paramagnetic and oxygen hemoglobin is not. So you need to weighted MRI images. More, it will be more contrast will be you can get by using tissue blood oxygen level dependent imaging. So these are the images taken by gold functional MRI. You can see these are the sites for visualization and volume movement. Gold is also having used to many aspects of brain functions, including memory, sensory perception, cognition, and education. And it should also be noted that gold is not only used for imaging brain function, it can also tell us about the deactivation hemoglobin levels in the tissues like kidneys. It can also be used to access the oxygenation status of the blood cell in person within of the tumors. And MR's magnetic resonance spectroscopy, it will work with the principle of electromagnetic pulses are sent to a sample and the extra magnet, the presence of electromagnetic field, and using a probe, we are measuring the RF signal. And this MR spectrum will use the chemical shifters which are indicated for the chemicals which are the chemicals present in this region. So MRS can be easily coupled with brain MRI. So we can at a time we can get the anatomy information as well as biochemical information. So hyperpolarized MRS. So in hyperpolarized MRS we are not using hydrogen bond nuclei. Here we are using non-proton nuclei and we are enhancing the signal by 10,000 folds. In hyperpolarization, we are making the nuclei hyperpolarization by using this optical pumping dynamic nuclear polarization and paramagnetic technique, and we are trying to enhance the signal reading more. And this is the currently using successful hyperpolarized substrate due to its long chemo relaxation time and rapid metabolism in input. And positive negative chromatography. So these are the sharp copper positive and radionuclides which are injected into the animal, and two annihilated protons are detected by the detector and immediately reconstructed. And these are the tumors, brain tumors. These are the images done by the partial negative chromatography. At the 10th day, the tumor size, and 11th day, the size is increasing. These are the currently using molecular imaging PET agents currently available in oncology. Mainly, all over they are using FDG PET, and the remaining things are also available for PET imaging, like prevention intervening and FLG, coding, and 13 annexing. This is based on the apoptic changes in the cell. Spectral work based on the single photon emission radionuclides. These are technetium 99, indium 123, indium 111. So these are detected in the noise, and single energy photons are detected by gamma detector and immediately reconstructed. This is the human we can detect by using this. Recently available molecular imaging agents are 19 mm technetium fluoride for dopamine transport imaging, and indium 111 DDTA. This can be used to identify the non-functional neuroendocrine tumors, which are TC failed to detect these tumors. But if you use this imaging agent, we can detect these tumors accurately. And 19 mm technetium annexing for imaging above basis. Fusion imaging. In PET or SPECT, we get only functional imaging, but by using the hybrid fusion imaging technique, we can get both anatomy and physiological information. So these are the commonly using fusion imaging techniques. One is PET-CT, PET-MRI, PET-CT, PET-MRI. We can see the change in fusion imaging. We can get both functional and anatomy information. And molecular imaging is also found. Currently they are using gas-filled microbubbles coated with lipids or biofibers and few micrometers in diameter. This will enhance the signal to noise ratio for blood. These are highly reflective than the other tissues. So we can get a better signal to noise ratio. These microtubules or several orders of magnitude more effective than normal tubes. However, by attaching certain peptides, antibodies, or other molecules to the surface of the microtubules, so these can be functionally linked to specific molecules and targeted this. So we can see this angiogenesis of the tumor in the mice without targeting. We may not be able to get much information. If we are targeting it, we can get the information. So these are the strengths and limitations of the molecular imaging with ultrasound. This is very cost effective, widely available, portable in nature. It will give good temporization, good safety profile. Because here we are not using any regulation and excellent sensitivity. But it has got some limitations. Typically, imaging structures that contain bone, hair, tissue, MSF, multiplexing is not currently possible, and primary approach analytical information. So, optical information. This can be two types. One is optical fluorescent imaging and bioimaging imaging. In optical fluorescent imaging, we are using fluorescent receptors, green fluorescent protein receptors, and some fluorescent molecules, dyes or nanoparticles are using in optical fluorescent imaging. In bioimaging imaging, we are using enzyme activation reactions are responsible for bioimaging imaging. These are the examples of the enzymes which are used in bioimaging. In optical imaging, we are injecting a fluorophore and we are exciting this fluorophore by using external light, and it will give the fluorescent light and it will detect the camera and image is presented. These are pre-treatment and post-treatment. And these are the recently used molecular imaging agents in fluorescent imaging. Actually, fluorescent-based imaging agents are less than this level. The absorption of light will be more. So, mainly they are using the fluorophores which are emitting the wavelength between 650 and 900 nanometers. So, this is the process how bioluminescence is happening. So, this is the luciferase reporter beam. It will transmit into luciferase MRI and it will transmit into luciferase reporter protein. If it reacts with substrate, it will produce the bioluminescent light. So in bioluminescence, we are injecting this enzyme into the mice and we are getting the fluorescent signal before treatment after treatment. And chemiluminescence imaging. The basic principle of chemical radiation is photo casting imaging and intraocular microscopy also using molecular imaging. Thank you for your question. Now I will invite Mr. Votu Sahib to record the stage. I will be speaking on molecular imaging application module.
Om Shri Sai Ram. I send a message to Swami Jyotisri. I'm going to speak on the molecular imaging applications in cardiology. The molecular imaging applications are like in molecular imaging of atherosclerosis, angiogenesis, thrombosis, or stem cells for mitochondrial regeneration, report gene and reporter probe approach, and neuroreceptor imaging. This image summarizes all the application of molecular imaging, like you can image edema, necrosis, apoptosis, inflammation, enzymatic activities, neurovascularization, and extracellular imaging using these different tracers or targets. So, imaging of atherosclerosis, imaging of using macrophages or annexin 5 or protease activities. Atherosclerosis is a leading cause of mortality in the developed world. A systemic inflammatory process characterized by fatty streak development, plaque formation, potential for plaque rupture and erosion, which leads to myocardial infarction or cerebrovascular accidents. Why there is a need of molecular imaging in atherosclerosis? Because the X-ray angiography can be used to assess luminal narrowing but cannot evaluate atherosclerosis that does not encroach on the lumen. The intravascular ultrasound MRI and three-dimensional carotid ultrasounds are capable of detecting plaque on the basis of their morphology or tissue composition, but cannot distinguish the molecular signature of ruptured plaque from those of stable flow. Therefore, the molecular imaging is a technique that can detect the molecular events that underpin plaque vulnerability and help identify patients at high risk of cardiovascular events, guide their therapy, and monitor their treatment accordingly. This image summarizes how important molecular imaging is. As you can see, the molecular imaging can image from the atherosclerosis, plaque rupture, ischemia, infection, all of these using the different targets of the radiopharmaceutical, whereas the physiological imaging can image only proptosis, necrosis, fibrosis, and similarly the anatomical image has a smaller area of diagnosis. This is the F18 FDG uptake of human carotid and thyroidic atherosclerosis plaque, which is in response to simvastatin therapy, and the upper one is for the diet, the baseline, the pre-treatment, the post-treatment. It clearly shows that F18 FDG uptake is not influenced by the dietary management. As a dietary management, there is not much of difference in the pre and the post-treatment. Whereas when somebody is simvastatin therapy, there is a clear difference in the pre and the post-treatment of the images. Imaging of macrophages. Macrophages are key factor of inflammatory cells in atherosclerosis. Nanoparticles in MRI or F18 FDG PET imaging. The clinical dextran-coated magnetic nanoparticles consist of 3 nanometers superparametric iron oxide core that induces strong MRI contrast on T2 and T2 star weighted images. The magnetic nanoparticles can non-invasively image macrophages in carotid erythromata with validation in carotid endarterectomy specimens. Potential gain in magnetic nanoparticle imaging in the coronary artery might be realized with an intravascular MRI catheter. The pattern of macrophages, FDG F18 accumulates in carotid erythroma and that it uptakes correlates with the macrophages as opposed to smooth muscle cells. The atherosclerosis images. The first one is the imaging inflammatory atherosclerosis in rabbit using gadolinium-loaded OX LDA target missile. The first one is the pre-injection. This is the MDA2 target, you can see it's more clear, and this is the untargeted. The second is the macrophages target nanoparticle enabled CT, you can see it clearly. And third one is the PET image. The recent developments are the imaging of target plaque macrophages with gadolinium-loaded immune missiles targeted to the macrophages, and the second is the imaging of macrophages with an iodine-loaded missiles in CT scans. This is one of the non-invasive MRI of carotid plaque macrophages using dextran-coated iron oxide magnetic nanoparticles. There is experimental MRI of inflammation in the atherosclerosis using multimodality magnetofluorescent nanoparticles. This is the pre-treatment and the post-treatment image. The integrated F18 FDG PET CT, this is the only CT where, and this is a PET CT, which subsequent correlates MRI of carotid atherosclerosis plaque. Imaging of annexin 5 with a 99 technician radiolabeled annexin 5. Annexin 5 is in the erythroma may target apoptotic cells in erythromata. Co-localization of annexin 5 with non-apoptotic macrophages and with intraplaque hemorrhage. The imaging protease activity agents like protease 750 and others. This may provide a high resolution approach to image inflammation in coronary plaque and may identify high risk lesions. The challenges of this approach includes the limitation of photon attenuation and scattering. The intravascular near-infrared fluoroscopy image of inflammation in experimental iliac erythrosis using a protease activity. Imaging of angiogenesis. Angiogenesis is a complex process which involves degradation of the basal membrane surrounding the parental vasculature, migration of endothelial cells, proliferation of crystals, element and organization of endothelial cells to form tubes. The process of angiogenesis involves the interplay of many cells including monocytes, macrophages, mast cells, lymphocytes, connective tissue cells, pericytes, endothelial cells and pluripotent progenitor cells, of which influence the process by secreting soluble angiogenic and anti-angiogenic molecules, including extracellular matrix and proteoidal enzymes. The potential target for imaging of angiogenesis falls into 3 principal categories: endothelial cell markers, non-endothelial cell involved in angiogenesis, and the markers for the extracellular matrix. The imaging of alpha beta 3 with targeted radionuclides and PET probes have been shown to detect angiogenesis in recent myocardial infarction in animals and in humans. These cases tend to localize in region where perfusion is most profoundly reduced Targeted imaging of growth factor receptor used to detect vascular remodeling. The growth factor imaging had most frequently relied on either using radionuclide labeled vascular endothelial growth factors. This is the endogenous image, the infraction. This is a normal MRI, this is the PET and MRI. Imaging of thrombosis, while imaging the fiber and the imaging of platelets. Thrombosis is the hallmark of multiple cardiovascular diseases, including acute coronary syndrome, stroke, and pulmonary embolism. Indium 111 labeled platelets is indicator of active thrombosis, as it corresponds to the fresh deposition of platelets on the thrombus. On theoretical grounds, this technique can also be used in patients with all diseases. This is the MRI of thrombosis patient. There is a thrombosis for MRI for coronary thrombosis in a swine model. Imaging of fibrin. Thrombin-mediated cleavage of fibrinogen yields fibrin monomers, which then polymerize and undergo cross-linkage to form a stable clot. Both arterial and venous thrombi contains fibrin, making fibrin an appealing target for thrombosing imaging. This is a non-invasive MRI of thrombosis with a fibrin-targeted paramagnetic imaging agent, the pre-treatment and the post-treatment image. Platelets are a major focus for modern antithrombotic therapies and an important molecular target in the fibrin receptor. The EP2104R specific diagnosis of thrombus may represent an advantage over traditional diagnosis method in recurrent pulmonary embolism. This is a non-invasive SPECT image of angiogenesis in a post-myocardial infarction patient after pre-percutaneous coronary intervention. After injection of an interin alpha V beta 3 target agent, after 3 weeks from the myocardial infarction. The upper one is the alpha V beta 3 target and the lower is the technetium system AB. Imaging of stem cells for myocardial regeneration. The stem cell only cure for end-stage congestive heart failure is the heart transplant, and therefore the studies on stem cells transplantation has been studied extensively from the last decade. These are the different stem cells which can be implanted into the ischemic or infrared myocardium can lead to varying degrees of benefits, including reduced infarct size, reverse ventricular remodeling, and improved left ventricular systolic function. Cell imaging requires the use of cell markers that ideally generate signal only when the marker is associated with the cell value is viable. Emits adequate signal for detection. Minimal perturbed cellular function causes minimal toxicity to the subject when it is released into the circulatory excretion. These are the images for stem cells. The characterization of SSSIHL embryonic stem cells derived from cardiomyocytes. This is the characterization of the stem cells. This is the image of massive SSSIHL direct cardiomyocyte injection into heart. The first one shows the cardiomyocyte isolated at the 11th day in the culture, where the second one shows the 18th day in the culture. You see that it's a fast recovery compared to the first one. The reported gene and reporter probe approach. Used in the evaluation of gene and cell-based therapies of the cardiovascular system, a suitable reporter gene product is generally not present in the target tissue and produces minimal effect on the tissue function. There are 4 different strategies of imaging reporter gene probe. First is the enzyme-based bioluminescence, enzyme-based SPECT, receptor-based SPECT imaging, and receptor-based MRI imaging. The neuroreceptor imaging, image of the sympathetic nervous system. The presynaptic and postsynaptic cardiac sympathetic function occurs in several cardiovascular diseases, including ischemic heart disease and heart failure. We can use the carbon level or iodine 123 to image them. Iodine 123 and EEG scan used to evaluate cardiac sympathetic nervous system distribution and function. These are the different presynaptic tracers and postsynaptic tracers which can be used for the imaging. This is an image of the normal distribution of presynaptic neural tracer in a healthy volunteer. The planar ID 123 dB images of myocardial sympathetic intervention in the CH progression, the class normal, class 2, class 4. The characteristic performance of common molecular imaging, where spatial resolution, image sensitivity, cost, advantages and disadvantages of SPECT, MRI, and CT. Thank you, sir.
Today I will be talking about the applications of molecular imaging in the field of oncology. Molecular imaging can act as an enhanced method, and it's a non-invasive means of detecting, staging, and monitoring cancer progression. MI can also be used to expedite cancer drug delivery, predict responders versus non-responders to certain treatment. We can unravel the underlying mechanism of cancer, determine the overall effectiveness of the therapies. And basically, cancer involves following like alteration of numerous surface cell receptors, sustained angiogenesis, alteration in signaling pathways, changes in cellular metabolism, hypoxia, apoptosis, etc. By using molecular imaging agents, we can target any one of the process, or we can target any two of the process to image the cancer. A definition of molecular imaging in oncology can be defined as in vivo characterization and measurement of the key biomolecules and molecularly based events that are fundamental to the malignant state. It also interrogates abnormal molecules as well as the apparent interaction of the altered molecules which are responsible for the cancer. In contrast, the classical diagnostic imaging primarily images the advanced manifestation of cancer. By using molecular imaging, we can detect the in early stage. Role of MI in oncology. What we are using in molecular imaging can have two different components like targeting components and signaling components. Targeting components may be some antibody, peptides or small molecule, whereas signaling components which are responsible for the signal they produce like radionuclide for spectrospect or fluorochrome for optical imaging and paramagnetic or nanoparticles. Molecular imaging in oncology can be defined on the basis of probes. They are classified as phenotypic probes, targeted probes, cell-tracking probes, or reporter gene probes. Going to the phenotypic probes, they used to access the general features of malignant physiology like metabolic changes, angiogenesis, hypoxia, apoptosis, etc. Hyperpolarized MRI. It's a new type of phenotypic MRI technology in which strong signal enhancement enables the imaging of nuclei other than protons. It provides a real-time insight into the tumor metabolism. The molecules which are being used are like pyruvate, bicarbonate, lactate, and others, which are part of our biochemical reaction or metabolism. And contrast reagents we are using are intrinsically very safe. For example, the 13C pyruvate, which is used for the prostate cancer. Target probes. They are used to image the specific image biomolecules like proteins or tumor-specific antigens, which are specific for that type of tumor. Example of targeted probe is like 124 iodine labeled chimeric antibody G250. It is used for the used to get imaging of carbonic anhydrase level, which is commonly overexpressed in the renal carcinoma. Cell tracking probes, it is used to localize and follow the movement of cells that which are required for the survival of the tumor, like vascular endothelium cells, stromal cells, or stem cells. They can be labeled directly or indirectly on the basis of the requirement. Reported gene probes. They are used to monitor the action of genes in the biological systems in vivo. Common example what we are seeing is gene expression imaging. Coming to the clinical application of MI in the field of oncology, I will be talking very briefly on it. Hyperpolarization MRI. It increases the robustness of the resulting image and it requires very short image evolution times. It allows direct insights into the metabolic pathways. Tissue pH can be accessed non-invasively by hyperpolarized MRI. Tissue pH, which is an important parameter in the tumors, which can be accessed to by this technique. The extracellular pH is often lower than the normal tissue and can be served as a biomarker for diagnosis. The pH is calculated by using this formula, which is called as Henderson-Hasselbalch equation. If we know the concentration of the bicarbonate and carbon dioxide. Mainly the hyperpolarized 13C labeled bicarbonate injected, which is converted into the hyperpolarized carbon dioxide by the action of carbonic anhydrase. This hyperpolarized carbon dioxide helps us to calculate the pH. So by using this technique, we can whole body pH mapping could be done. The first image is the MRI image of a mouse with subcutaneous implanted nasal lymphoma, and BCD are the hyperpolarized MRI image. We can see that the acidic level which can be found out through this technique. And they are also used for the lung studies, like 3-helium has been used for study of lung, and other like 129 xenon and 3-helium. FDG PET-CT is the most relevant biomarker for the cancer remains the glucose analog FDG. PET detects and characterizes the tumors based on the molecular alteration, while other conventional imaging modalities detects based on the morphological alteration. Basically, FDG is injected, it is taken up by the tumor cells because it is an analog of glucose, and FDG is converted to the FDG6 monophosphate by the action of hexokinase. And by this, it is due to driving of the metabolite within the tumor cell. which is mainly the tumor cell will have one of the hallmarks like increasing the glucose metabolism in conversion of glucose carbon to lactate, which are characteristics of cells. This glucose metabolism in increased level is due to the increased respiration activity of glucose transporters or some changes in the glycolytic enzymes. So PET-CT is also helpful in the localization of tumors in case where conventional diagnostic methods are unable to localize the primary site. It helps in the staging of cancers like normal cell lung cancer, esophageal cancer, GI tract cancer, thyroid cancer, head and neck cancers. Some other new PET tracers have improved the accuracy of PET like 11C choline PET-CT, which is commonly used for prostate cancer, and 68 gallium prototype, which is used for neuroendocrine tumors imaging, F18 fluorotestosterone FDST, commonly used for prostate cancer and bone metastasis. So this image shows the whole body image by using the 99M technetium. This is by using the FDG PET. This is by using the tracer FDHT PET. So we can see that FDG PET showing the metastasis in some of the portion, where FDHT is showing the metastasis in other part of the region. So this tracer is comparatively good compared to this. Apoptosis imaging, it can be performed through targeting of extracellular and intracellular products of programmed cell death. NXN5 is able to identify the extracellular phosphatidyl serine and can be used to detect apoptotic cells. NXN5 belongs to the family of proteins with anticoagulant properties. Basically, NXN5 binds to the negatively charged phospholipids like phosphatidyl serine in the presence of calcium, and its minimal binding to the phosphatidyl choline and others which are present on the external side of the cell membrane. NXN5 labeled with F18 has been developed for apoptosis imaging. And advantage of PET imaging compared to scintigraphy, F18 NXN5 has lower uptake in the liver state compared to the usage of 99M technetium NXN5. So this is the image showing the whole body image of a patient by using a 99M technetium NXN. We can see the tumor in the left breast to visualize. Hypoxia imaging. Agents which are responsible for the hypoxia activation like hypoxia inducible factor 1 activation protein. These agents affect the behavior of genes that control the angiogenesis and cell cycle regulation and apoptosis, and also encourage the cancer cells to divide more rapidly. And PET imaging agents for hypoxia are like 18F, FMIS, F18, FSZA, F18, FDNM, F18, BF5, 64, CU, ADSL. Some of the common advantages of F18 FMS that binds covertly to the intercellular micromolecules, and they show promise for predicting the response to the radiotherapy. But some disadvantages like specific accumulation clearance from the non-toxic tissue. Targeted bone nanoparticles. This study where mice was implanted with the women's common cell carcinoma, head and neck cancer. Anti-epidermal growth factor receptor conjugated bone nanoparticles were intravenously injected into the mice, and results showed that the small tumor, which is currently undetectable through the anatomical computed tomography, is enhanced and becomes clearly visible by the molecular imaging. Molecularly targeted bone nanoparticle, which is non-invasive, non-enhancing molecular cancer imaging tool and can facilitate early cancer detection. These tumors were extremely high level of EGFR, which is epidermal growth factor receptor. So we are using anti-GFR antibody. So by using this image, we can see that this is the mouse with without gold nanoparticles. It is mouse with the non-targeted gold nanoparticles and mouse with the non-targeted bone nanoparticles. You can see the enhancement of contrast of tumor is seen in this. And neuroendocrine tumor imaging, we can use the trailers like 11C, 5-hydroxytryptophan and 68 gallium. And for lung cancer, many cancers rely on the glucose metabolism. So FDG is a non-metabolized glucose enhancer. Now FDG PET-CT is perhaps the most obvious in the evolution of the non-small cell lung cancer. So A is we can see through this. A is the CT image, which is showing the lump in this side of the lung, and it is showing the FDG uptake mode. And the B it is showing the lesion in the lung, but FDG uptake is not seen by using the FDG PET-CT. While CT is showing negative, but here we are showing the bone metastasis present here. FDG PET-CT. MI abdominal oncology. We cannot use the F18 FDG for the abdominal oncology because of certain limitations like lower variable glycolytic activity of some tumor entities and some physiological overuptake and urinary excretion of the 18F FDG. Commonly used abdominal oncology agents are like 11C choline, F18 FP, glutathione, and 11C choline, which is used for imaging of prostate cancer. And advantage of the tracer uptake in urinary excretion is very low. It accumulates not only in the prostatic carcinoma but also carcinomas of the bladder. It can be substitute for the F18 FDG tumor related to the urinary tract. So we can see this is the PET image, but we are not able to differentiate the lymphoma, the tracer, and the accumulation of tracer with the lymph node. Here it is CT and it is a fused image. And by using analytic volume, we can see the high accumulation that where the tumor is. This same as CT. This CT also so like it, and here we can see the accumulation of the tracer over here. So it is a patient with adenocarcinoma. Some offering in Bhagwan Buddha state language tracer.
Om Shri Sairam. I offer my humble pranams at Bhagwan's Lotus feet. Revered Director, HODs, Dean, Doctors, DNVs, one and all present here. Good afternoon and warm Sairam to one and all. Swami says, serve until you see God within. Parobakaram Vidam Shariram. Today my topic is molecular imaging in orthopedics application. After hearing what is molecular imaging, let's say in orthopedics, the non-invasive visualization and measurement of bone and joint tissue biology is one of the remarkable accomplishments in recent orthopedic research. It said, so there are three distinct pathways. One is through molecular imaging, you can deduct biological pathways that simplifies data interpretation by minimizing consequence of variations between individual living subjects and also ability to image a specific biological target. So molecular image applies especially in drug discovery and development process. So orthopedics deals with four letters, that is SAMS, that is stability, articulation, neuromuscular and symmetry. Stability deals with the person as the stability of their bones, and artifaction is includes with the joint, and neuromuscular deals with the nerve which connects to the bone and the symmetry of the body. So here I quote Charlton Heston. He says, in all of Shakespeare's plays, no matter what tragic events occur, no matter what rises and falls, we learn to stability in the end. Hence, orthopedic plays a vital role in the man's human being living. So why molecular imaging is required in orthopedics? Bone is a complex tissue comprised of the variety of different cell types as well as variable amounts of organic and inorganic materials. As a result, study of bone cell biology almost impossible in ex vivo and difficult to cultivate intact bone tissue outside an organism. It also applies to the cartilage, ligaments and tendons, where it is difficult to maintain the tissues in culture isolated cells from these and in situ environment. In vitro method provides opportunity to study a specific biological mechanism. However, such models are restricted because of the labor intensive and most of the analytical readouts have a time lag between tissue sampling and evolution. Hence, it's not real time. Hence, molecular imaging can circumvent those limitations through direct assessment in the living model, perhaps of greatest importance in orthopedic models in impact of the mechanical load on tissue. That's why molecular imaging became an important part in orthopedic research. Here, there are in nuclear imaging, there are certain modalities are there. That is nuclear modalities, optical imaging, and magnetic resonances. Here, this slide shows that the sensitivity of the nuclear medicine is very high, whereas the optical imaging is moderate. Hence, you take the anatomical information, nuclear medicine is null, but whereas in MRI it's less. So hence the upcoming and fusion imaging, when you go for the PET MRI or SPECT MRI, we'll get a better resolution and we can get a better imaging. We can detect both morphological and anatomical resolution. Now, conferring imaging immunity. Three types of such methods are relevant to current orthopedic molecular imaging. One is the radiopharmaceutical. The main difference of the molecular imaging is the because of the probes as the biomarkers, because of the personalized medical, as the radiopharmaceutical and iron oxide particles can diffuse across the cell membrane or used for cell marking. Cell labeled with radiopharmaceutical oxides or oxide compounds can be detected by the nuclear imaging, whereas cell harboring iron oxides can be imaged by the appropriate MRI. So here are the new radiopharmaceutical which applies in nuclear medicine. The specs follows the indium, technetium and gallium, and PET has the gallium and F18, the fluorine 18. Here the spatial resolution is very high when you go for a PET imaging. The reason would suggest an adverse influence of the iron oxide labeled specificity on the chondrocyte differentiation, but an important study could not confirm these findings. Since experimental conditions were different between those studies, no general conclusions can be derived and further investigations are necessary. And this has been published in the Journal of Bone. Here, molecular imaging helps in orthopedic research. After come across all the problems in regards to conferring imaging visibility, a cell type or protein can also be detected through the nuclear or optical imaging using an antibody labeled with isotope. The specificity of fluorescency labeled annexin 5 protein can be explored for optical imaging for apoptotic cells. It can also imaging reporter genes, it can also imaging musculoskeletal genes. Imaging reporter genes typically code for the exogenous protein that can detect readily and specifically in a non-invasive manner. The image reporter genes regulates the report gene expression. It can also ability to choose and manipulate the control elements, making imaging reporter genes. Here is the application of molecular imaging in musculoskeletal systems. Here it follows: the firefly luciferase is a currently preferred imaging reporter genes. These enzymes oxidize luciferin in the ATP dependence in the bioluminescence, which enhance tissue penetration. Imaging reporter genes, and such model has been, the transgenic animal has been taken as a model, and they gone through the imaging reporter genes in the bioluminescence method. It can also control of the osteocalcin and control of the estrogen responsive elements. It can also regulate hormonal regulations in the body. Molecular imaging, the various applications, it can help in imaging probes, bone formation, repair and regeneration, bone precursor cells and direct osteogenesis, transplanted bone precursor cells, site-specific tissue repair. It can image an osteoblast and organic mineral phases, bone modeling and remodeling, arthritis, inflammation, etc. Here the probes are labeled, it's non-toxic, it's very specific for the particular diseases. Designed to target an in vivo. The probes presently used for the molecular imaging is a musculoskeletal tissues carries NIR fluoroscope for the optical imaging. Here it can also detect prosthetic joint infections. Molecular based techniques use the polymerase chain reaction, that is PCR, developed by the Karen Mullis, seems to be promising diagnostic modality. It gives, because of these factors, it is very sensitive, specificity, positive predictive value and speed. PCR can also detect gene associated with antibiotic resistance. Most of the recent reviewers are in the agreement that molecular diagnosis has enough potential for future application in orthopedics. Here is the polymerase chain reaction. It follows there are different methods: the denaturation, annihilation, and extension. So when during the annihilation, the primers which extends, then the primer which extends to the particular environment, it gives a polymerase chain reactions. There is a flowchart of the infection in clinics. When the person get injured, it can go for when it is the infection is positive, it can go for the WBC scan, or it can go for the triple phase coma, and it can go for the physical therapy. And the specific point is the antibiotic therapy that gives a reimplantation, and it can do site. The imaging bone formation, repair and regeneration. Osteogenesis is the process fundamental to embryonic skeletal development, postnatal modeling and remodeling, as well as bone repair. Osteoblast, which is responsible for the bone formation, arise in a tightly regulated differentiation sequence from distant cells. In this regard, molecular imaging has helped in utilization of transplanted stem cells in vivo transplantation. Like here, it can also detect bone precursor cells and direct osteogenesis. Osteogenesis aims to form intact bone at sites of bone damage and relies on bone precursor cells, including the stem cells containing bone marrow stem cells, that is MSC. It acts as a source of the bone-producing osteoblast. The discovery that bone precursor cells can be harvested and transplanted has promoted many treatment studies such as osteogenesis imperfecta and local repair of skeletal defects. Here, I will take this opportunity to acknowledge our institution to taking up the stem cell research in the chondrocyte culture. I hope the molecular imaging can put forward and helps in imaging stem cell in the future. Here it gives the bone spurs this leg shows the osteoarthritis of the knees. It's one of the most common of joint disorders and characterized by the joint pain. Here's the formation of the bone spurs. Again, molecular imaging, transplanted bones precursor cells. It's based on the very simple idea the administrative cells are expected to bone and then new bone tissues. To this end, molecular imaging studies are promising and several were conducted to demonstrate the feasibility of the bone precursor cells imaging in vivo. Nuclear imaging was a method of choice for investigating the biodistribution of systematically transplanted stem cells in all the studies. It can also image the osteoblast and bone formation. It's a conjunction with the osteoclast or essential to the bone development and maintenance. Non-invasive imaging studies on osteoblasts strive to improve the understanding of how they function and how they regulate in the intact organisms. Here, F18 NAF deposition in the bone. The re-emergence of F18 NAF bone imaging was ignited by the introduction of PET and PET-CT recently, which permits assessment of bone disease with accuracy than the planar imaging spec. Hence, the current discussion focuses on the molecular imaging of F18 deposition on bone and also regenerative medicine. So here, this image, it gives a knowledge of the F18. The study was taken in the 4 week, 6 week, and 8 week. Here in the plain radiograph, we could not see the osteoblastic lesion. So, but the PET-CT, that is by using F18, the PET-CT gives the osteoblastic lesion earlier than the 4 weeks than the radiograph information. The increasing F18 uptake over time corresponds to the increased bone formation. It is confirmed by the histological method. The bone modeling. Molecular imaging offers whole skeletal assessment of the bone and tightly regulated process with the bone remodeling. In the studies describes bone minerals at sites of bone formation as well as the tumor development to be imaged. The hormonal regulation in living bones can also be investigated. Imaging and arthritis. Arthritics characterized by the joint destruction and pain. The majority of arthritis show characteristics of the rheumatic arthritis and osteoarthritis. Anatomical imaging through X-ray and MRI is currently an important part of arthritis. Presently, molecular imaging of the rheumatic arthritis and arthritic is under investigation. Probably in the future it can serve the purpose. Here I will present the case study. A 20-year non-sickle patient complains worsening pain of the right knee, joint, effusion, etc. He has undergone the MR coronal studies and the whole body scan by using SPECT and SPECT-CT by using molecular imaging that is labeled the granulocytes. So here he would present MR coronal imaging showing an osteoclastic area on the right knee. The image has a non-specific features, whereas when he has undergone SPECT imaging, the segmentary SPECT imaging of the whole body scan, there is evidence of the hotspot corresponding to an area of the increased bone matrix deposition. When he has gone for SPECT-CT, there's a fusion imaging, the scintigraphy with labeled granulocytes, SPECT-CT fused imaging. There is evidence, he has gone for the coronal these are the images of the coronal, sagittal and transitional images. There is evidence of intense radiopharmaceutical uptake correspond to the infectious focus later diagnosed as osteomyelitis caused by the Solana species. A targeted antibiotic therapy was started with a complete relief. It was found out from the F18 image, the PET-CT gives the molecular imaging gives fused image on follow-up. After the 30 days, which was unremarkable, the study was there is evidence of cold area corresponding to the previous noticed infectious focus. There is a difference in the here hotspot, but whereas here the cold, they could find out the cold area here. The results: the use of PET instead of labeled granulocytes was designed to avoid possible allergic infection. In fact, labeled granulocytes in vivo are using radioactive antibiotics which are rarely responsive of the allergic reaction. This study was taken from the studies in nuclear medicine techniques, a better weapon in detecting a rare of epiphyseal osteomyelitis caused by the salmonella in patients, published in 2013. As a conclusion, I would like to say, the methodological advance of molecular imaging, including non-destructive, fast and reliable detection, single-session evaluation of the whole skeleton, and repeated longitudinal real-time measurement in individual subset highlights invisible the opportunity for the molecular imaging in orthopedics. Modern orthopedic research, the understanding of molecular mechanisms that development of maintenance and health of musculoskeletal tissue. In recent years, many genital and proteomic discoveries have been made with necessities in investigation under physiological condition intact living tissue. Molecular imaging can meet this demand and is in fact the only strategy currently available for non-invasive, quantitative, the real-time biology studies in living subjects. These studies addresses malignancy and injury as well as repair, including fracture healing, cell gene therapy for skeletal tissue. In the joints, molecular imaging has focused on the inflammatory and tissue destructive process that cause arthritis. The feasibility of applying molecular imaging to numerous areas of orthopedic research has been demonstrated and will likely result in the increase in research dedicated to this powerful strategy. Hence, molecular imaging holds great promise in the future for preclinical orthopedic research as well as the next generation clinical musculoskeletal diagnosis. Thank you. Thanks for the patient listening. At last, I would like to acknowledge my institutions to giving this opportunity to serve patients, and thank you one and all.
Offering myself to the divine, respected elders, dear brothers and sisters, I am to one and all. I would like to thank the authorities for giving us an opportunity to speak in front of it. My topic for today is molecular imaging application in urology. Here, there are certain applications of molecular imaging in urology like bone metastasis, total body detection, prostate-specific antigen relapse, initial staging, treatment response, lymph node metastasis. What is prostate cancer? Prostate cancer. Prostate carcinoma is the most prevalent type of cancer in men. About 30% of men aged between 30 to 40 years and in 64% of men aged between 60 to 70 years. Radical prostatectomy is considered the first choice of the treatment for the patients with prostate cancer. Two factors that determine the risk of the prostate cancer are increasing age, ethnical origin, and heredity. According to the European and American Cancer Society guidelines, the PC include annual screening by DRE, that is digital rectal examination, and serum prostate-specific antigen, that is PSA levels, for men aged 50 years or older who have 10-year life expectancy. PSA is the most commonly used biochemical marker. Measurement of PSA level is used in the early diagnosis of PC, that is prostate cancer, in which the higher the value, the more likely is the existence of this tumor. Imaging techniques are evolving together with the improvement in the biological markers in both the diagnosis and the screening settings. Although PSA has been used broadly for a substantial amount of time, that is for prostate cancer gene 3, a prostate but non-cancer specific marker has been recommended as a molecular marker. PCA3 is the messenger RNA that is found specifically in cancer tissue which can be detected in urine after DRE. Major goal of PC imaging is to more accurate disease characterization through the synthesis of anatomical, functional, and molecular imaging information. Current standard imaging techniques are ultrasound, MRI, CT, and nuclear medicine. These are the current molecular imaging agents in the prostate cancer like FDG, technetium, MDP, 18F, NAF, and F11, C choline, 18F choline, 11C acetate, etc. These are also some like 11C-methanine which are used as initial staging agents, and there are certain applications like TUD that is used by the using of agent, that is indium 111J591. Coming to the PET, that is it is used as a diagnosis tumor before the traditional radiological modalities. PET CT scanners during the same session give both anatomic and metabolic information. Here 18F FDG PET has been used in the past in staging patient diagnosis with bladder cancers, the detection of the primary tumor and local visceral tumor, recurrence is limited due to the presence of excreted FBG in urinary tract, which often mask the urinary bladder lesions and probably the adjacent lymph nodes. Diuretics are most suited for this purpose as they have the elimination of the excreted 18F FBG without interfering the vesical tumor FBG uptake. Given the applications of the FBG PET in genital urinary oncology, that is the prostate cancer, bladder cancer, renal cell carcinoma, testicular cancer, where the applications and limitations of each are mentioned. Furosemide is a loop diuretic as it causes maximal diuresis, which allows a sufficient time window for reduction of the bladder activity before any significant biological decay of 18F FBG taking place. The present prospective study was undertaken to evaluate the potential application of diuretic FBG PET in the detection and loco-regional staging of the urinary bladder tumors. The utility of PET-CT in detection of tumor relapse, even with the low rate of increase of PSA serum level with the radical prostatectomy has been reported. Here the PSA relapse is in most cases recurrent disease, presently initially a biochemical recurrence with an increase in serum level of PSA. Approximately one-third of the patients are undergoing radical prostatectomy and similar number of patients with the radiation therapy will develop BCR. In the majority of the cases, the early level PSA occurs. The clinical behavior of the patient group is extremely heterogeneous and it is not usual for the patient to survive for 5 to 10 years with an elevated PSA. Many studies for this are frequently negative. Here it is a case where the image you are seeing is the normal PET scan, where after that, by combining the CT with PET, you can see the lymph nodes, which you can see the lymph nodes here, which is having the activity of F18 choline. Lipid metabolism agents, prostate cancer cells have been shown to increase fatty acid metabolism with the upregulation of them and increased activity of lipogenic enzymes. Here you can see the 18F choline and 11C choline and also the 11C estate in prostate cancer have been associated with the choline kinase and fatty acid synthase, out of which there is a major advantage of F18 choline is that it is having a longer half-life. And however, the urinary excretion is higher for F18 choline and is accumulated in the bladder. 11C choline uptakes and correlates with the PSA velocity and doubling the time. Here the 11C acetate is used for the restaging and studies have been enhanced sensitivity with compared to the FBG 18F. Now here you can see the choline is also a component of the phosphodiol choline and important element in the cell membrane. Here, because particularly if it is increased in the cell membrane, it induces the higher uptake of the choline and it is due to the increase in the prostate cancer. Therefore, in vivo uptake of 18F choline provides information about extension and growth of the tumor including PC. Here is one such case where the PSA relapse has been seen. The first is the choline uptake and FBG is shown normally in the lymph node. While doing the PET-CT scan and MRI, you can see the lymph node with the spiny core MRI that is T2 weighted and contrast enhanced fat suppressed T1 weighted MRI. Now coming to the 11C estate PET for the patient, here you can see the lymph node. Here you can see the small area focal uptake with SUV max of 2.6, where the correlated of the endorectal MRI finding suspicion of the recurrence close to the urethral anastomosis. Salvage of the patient, salvage RT was rapidly initiated within the 1 month of the uptake of the calcium and the PSA level came down to 0.06 nanogram per ml. Here the amino acid analogs, amino acids like leucine, methionine and glutamine are effectively taken up by the tumor because of the increased amino acid transport and metabolism. Here the amino acid analog is anti-18F FACBC. This probe was shown early clinical success in imaging primary recurrent disease in the prostate, pelvic lymph nodes and bone with the improved sensitivity. Here is the application of the 18F FAC-BC, where you can see the left external iliac node, which was when uptake of the radial pressure was taken on the PET side CT, it was, you can see the uptake of the radial pressure which was not so prominent with the Indian 111 caprolab candidate in the SPECT study. Here is another 18F DCFBC PET, where you can see in the normal study here. Normal study was in the L4 region, while in the PET study you can see the hot spot which was in the normal bone scan was not seen. Nucleoside analogs and thymidine analogs are 18F FMAU and 18F FLT are biomarkers of cellular proliferation. 18F FMAU has been evaluated in the phase 0 study of several cancers, and uptake in the primary prostate cancer and bone metastasis was observed. 18F FLT has been potentially many cancers of evaluation of early treatment response. It is currently being tested in prostate cancer clinical trials. Coming to the molecular target agent, that is 18F FDSP. Here it is basically used with the PSMA, that is prostate specific membrane antigen. It is a well categorized biomarker that has been recognized in the molecular imaging target in the prostate cancer for many years. PSMA and integral membrane glycoprotein that is highly regulated in the prostate cancer. This is the uptake of the PSMA, in which you can see the vertical column which is having the uptake of PSMA in the sagittal and as well as the coronal images, while after 4 hours there is no trace of the FDSP PET, which compared to the cardiac and aortic blood pool. Coming to the renal cell carcinoma, that is the staging of the renal cell carcinoma. Here you can see in the images that is coronal FDG PET images and coronal CT images and coronal PET fusion images show abnormal FDG uptake in the right renal masses. This is the staging of continuing staging the transition PET set and fusion images as well as coronal PET set fusion images show the tumor expansion into the right renal vein and inferior vena cava. Coming to the use of Raman molecular imaging for diagnostic of the bladder cancer in urine specimen, it is non-invasive diagnostic of bladder cancer in various characteristics of malignant cell found in the urine have been used for this purpose. The only clinical method used today is urinary cytology. It is characterized by the high specificity and low sensitivity, especially in the low-grade tumors. Raman molecular imaging is an optical technology that combines the molecular chemical analysis of Raman spectroscopy with a high definition of digital microscopic visualization. Raman spectroscopy is used as a diagnostic tool for discriminating between disease and normal tissue through detecting the endogenous spectra. Monochromatic light is used to excite a molecule. Most photons are scattered elastically, that is really scattering will take place, and display shift in frequency compared with the frequency of excitation of light. Here is a schematic diagram of the flexible microscope which is used for this purpose. This approach permits visualization of the physical architecture and molecular environment of the cell in the urine. The Raman spectrum of the cell is a complex product of its chemical bond. Raman signals were obtained in urothelial carcinoma tissue from the widened urinary cell studied using flexible microscope. This is the flexible microscope. Using flexible microscope and green laser illumination. This is the surface enhanced Raman spectroscopy where the nanoparticles are different. These are the peaks where it is uptaken in the body. This is the spectrum where 1584 deals with the high grade cell spectrum, low grade cell spectrum, and normal cell spectrum with the uptake of the cancerous cell. This is the future molecular imaging agents in prostate cancer with the mechanism target that is like 89 zirconium DFO J591. This is the study in which there is uptake of the tumor to muscle ratio of the left cap PSMA positive is from 3 hours to 144 hours. The study was done where it was 26 raised to 1. While in case of the PC3 PSMA negative, the tumor to muscle ratio came down to 5.5:1, that is at the 144th hour. These are some more agents. These are the case where it is seen that a 65-year-old man with carcinoma of urinary underwent a staging of blood set, and here you can see the bladder mass in the urinary radioactivity occupying the remaining bladder cavity. The spots which views of the urinary bladder were taken after diuretic administration, where it usually means the bladder mass at the distended bladder on CT. This is another case where multiple soft tissue neural lesions are noted arising from the bladder wall on the post-diuretic images, that is in the CT, while in PET CT it is more clearly visible. This is the stem cell neurology, where the stem cell played a lead role in the renal cell development, which is again transplanted into the patient. This is one of the applications where tissue engineering of the urethra is using a collagen matrix, representative case of a patient with a bulbous stricture. Urethral repair stricture used is excised, resulting in a urethral plate on the left side. Here this is the urethral plate they put on the left side in the matrix, and otherwise on the urethral plate in an only fashion on the right. And this is ureterogram which is taken in the before the use of stem cell was taken place. This is after the stem cell has been used and has been proliferated with a good result. Thank you. Yes, sir.
I'd like to thank all of you for your patient listening, the administration for giving us the opportunity to speak in front of all of you, the IT department and other. I'd like to request the director, sir, to come and speak few words about this presentation, and the other chairpersons also.
When I'm looking at this, this may look like something they have presented out of a movie like Star Wars or something. It's not so. It's realistic because clinical application is not far away. Really, clinical application is not far away. And of these presentations, obviously orthopedics is at the forefront with chondrocyte regeneration. But what they presented for say a stem cell use in people with diminished left ventricular function or people coming with acute myocardial infarction is possible here. I don't know how many of you know that with the blessing of the management, we will soon get a level 3 lab here. So where we could really grow stem cells. Seriously, we can really grow stem cells. Then it's a question of clinical application. So this may look like they are presenting something out of the blue, but it is not so. And the same way you can see in urological presentations how much this is applicable as far as the clinical, either staging or taking into account the effectiveness of curing, say, prostatic cancer, or we have one of the largest collection of, I saw Dr. Sain somewhere here, we have the largest collection of urethral strictures. Absolutely. So if you can use this modality, we'll be up in the forefront. See, with Swami's grace, we have what others don't have. That's the most varied pathology that's presented anywhere else in the world. A lot of visiting surgeons say it takes them 6 months to see what they can see in 1 week in our background. So I think it is again Swami's gift to us that we have these young people come by and just do some intellectual stimulation and transit into the clinical stage. And I have to say something. How they could jump from totally non-medical background to present a totally complex system like this. It must be just their preparation plus Swami's grace. We must give them a No. You're looking at people who are totally non-medical and talking about your analysis, PSA analysis, or you're talking about myocardial regeneration, or talking about a salmonella hotspot. So this is real. This is real, and I think we can only go forward from here. So my vision, seriously, for Swami is to put this thing under whatever we call regenerative medicine, regenerative department. And this is real also because Monday they're laying a foundation stone for advanced research, and so I think we should really thank Swami and say Jai Sai Ram. Jai Sai Ram.
Thanks to all of you, and especially thanks to Swami for starting this course for all of us and allowing us to serve in this hospital and allowing us to serve his patients in this place. We are very grateful to you, Swami, and all five of us will be always grateful to you for providing us this opportunity. Thank you, Swami, and thank you all of you.